Hi, I'm Cindy Perlin, founder and CEO of the Alternative Pain Treatment Directory, and I'm here with one of our amazing listed providers, Susan Baumann, who's an occupational therapist and biofeedback therapist. So, Susan, just tell us in a few words about your practice and where you're located.
Okay, I'd be happy to. So, I specialize in working with people living with chronic pain, anxiety, and insomnia. Sometimes people have all three, and sometimes you might just be coming for one of those things. But it biofeedback therapy is ideal for people who either cannot tolerate the side effects of their medications or would just plain prefer to not have to rely on long-term medication use. So you're going to learn lifelong techniques when you come to biofeedback therapy on how to reverse the pain and stress response in the moment of your pain ratcheting up or your anxiety ratcheting up. You can nip it in the bud, reverse it, and get on with your day and not have it ruin the rest of your day and just hope for better the next day. So you will learn techniques. What I love about it is there's no guesswork involved. When you come, you're in a recliner and you're attached to this computer here, and we're monitoring your heart rate, your respiration rate, your surface EMG muscle tension of tight neck and shoulders, and facial muscles, and skin conductance and hand temperature, and all these physical indicators of what your body uniquely does as it's reacting to stress. And of course, pain is very, very stressful. And we learn techniques that work for your body. And we're both seen on the computer screen at the time of trying it out, like, is this really helping or not? And then again, there's no guesswork involved. We're both looking like, oh, that was fantastic. Can I do it again? Or was it a fluke? Oh, I did it again. How did I do that? And you can learn to master these skills where it kicks in faster and faster, where it becomes something that you can use in the moment on the fly when you're out and about, when you're at work, when you're driving, when you're at the store, and you feel things getting worse, pain or anxiety wise, and you can reverse it right in that moment and take care of it.
Yeah, I'm also a biofeedback practitioner, and over the years, what I found is often people come in and they've learned meditation or some other relaxation technique, but they didn't keep it up because they didn't think that it worked. And when I, set up the biofeedback and I'm monitoring their physiology and I say, do the technique that you learned before and let's see what happens. And they can actually see the difference, that they're successful. Maybe they don't have a dramatic shift, but they're going in the right direction. That validates that the skill that they learned is useful, and it motivates them to keep doing it. And I even had a 1-session blood pressure cure with somebody,
Oh,
high
nice.
pressure, where, she'd learned meditation, practiced it for a while, but she gave it up. And as soon as she realized that when she does it, changes happen, she went back to it. And she only needed 1 session with me. And
Oh,
she,
that's fantastic. Sometimes people take it and they run with it, and it's fantastic. Other people need a little bit longer, but that's okay. Everyone does it at their own pace. But yeah, absolutely. It's so self-validating when you can see your own numbers improving, and then you can match your numbers with how you're feeling when it's happening and really start tuning into that.
yeah. So, talk about the measures that are particularly relevant to chronic pain relief.
For the chronic pain, we really focus on the surface EMG muscle tension, and we'll start with facial muscles, neck and upper trap muscles, but then we'll also go to specific spots of particular pain or muscle spasms and tightness, wherever that is on your body. And we will down train that excess muscle tension and bring your awareness into recognizing when it's starting to get tighter and how to release it several times a day. So you learn to kind of soften around the pain, because human nature reaction to when pain is getting worse or there's a large stressor, human nature reaction to that is we tighten up our muscles and protect and guard ourselves and kind of hold your breath and wait for the bad thing to pass. And we're not doing those things on purpose, but it does intensify and prolong those symptoms. So you can learn to catch, like, oh my gosh, I'm holding my breath and I'm squeezing and clenching my muscles. You can undo those things on purpose, even though we weren't doing them to begin with on purpose. So with the chronic pain, we're doing a lot of focus on the breathing and down training excess muscle tension. But then, of course, if you're living with chronic pain every day, that can also spiral into anxiety and sleepless nights where you're not sleeping because you can't get comfortable, or now you're worried about all the many things that go along with how the pain is affecting your day-to-day life. So then we can go into some mind quieting techniques, because of course you can learn to slow your breathing down and you can learn to unclench tight muscles. But if your mind is going 100 miles an hour, then your whole central nervous system gears up to match the pace of your brain, and your poor body never stands a chance to get or stay relaxed or go back to sleep. So I also work with cognitive behavioral therapy for insomnia, which is a very specific protocol that we'll use in addition to the biofeedback techniques. So you learn to calm your body, calm your nervous system, and quiet your mind, which will lessen the pain and it will help improve your sleep at night. I also like to incorporate craniosacral. I do those sessions as well, and I found over the years that to be a wonderful combination, where a craniosacral session can get your body super relaxed and feeling good, and the biofeedback sessions will teach you how to stay that way. And I've also learned to incorporate Feldenkrais movement therapy as well. So there's a whole combination of different things we're doing in here that you can learn, practice, get really good at it, and then just keep up with it. You learn these lifelong skills that you can continue on with.
So talk a little bit about what craniosacral looks like. Like, what are people doing or what are you doing during the course?
Yes. So it is not where I'm not kneading your muscles. It's not that kind of a massage, but you're lying down on your back. You're fully dressed with your knees elevated on a wedge, because that'll feel better on your low back. If you're not totally flat, if your knees are elevated, it feels better. And it's a very soft, slow, gentle, structured 10-step protocol. My hands are on you for 45 minutes. And a ton of time is spent on head, neck, and shoulders and low back. And it just feels like a very nice release of pressure. And your muscles are super relaxed and you feel very noodly by the end. So if you walked into your session in fight or flight mode from the pain and the stress, you will walk out on the parasympathetic side of the chart. So it does a wonderful job of calming your nervous system and relaxing your muscles.
Okay. And then how does Feldenkrais work?
Feldenkrais is a wonderful, gentle movement therapy that increases your mobility and decreases your chronic pain. And it's super gentle. Anyone can do it, because even if you can't do it all the way, you can just do tiny, tiny approximations of each movement. And you can do it lying on your back on the bed, or you can even be sitting in a recliner and do it from whatever position you can be in. And it just involves very slow, subtle movements. And there's different movement sequences you do for different body parts that are bothering you that day. Once you do it with me one-on-one in the clinic and you get used to it, then that's something you can continue on for yourself for forever after that.
So can you talk about someone that you worked with who came in with with chronic pain, and how you how these different techniques or combinations of them help that person?
Absolutely. So I've had many people over the years that have fibromyalgia to the point of, you might have to choose between taking a shower that day or doing a load of laundry or making a meal for your family, that you didn't have the time, or not the time, you didn't have the energy to get through more than one of those things in one day. And with biofeedback and craniosacral and Feldenkrais and learning all the techniques, we talk about also, we look at anti-inflammatory diets and gentle exercise you can do at home, but you're learning how to structure your day and pace and prioritize. And when something is starting to make your pain worse, how to back off and modify each thing, where by the time you're done with this round of therapy, you learn to structure your life where you can get everything done that you need that was important to you that day, instead of just going, I give up. I guess I'm unable to have a life anymore. So you're kind of taking your life back when you learn how to do these things and take care of yourself in the moment, where now you're in charge of how your day goes versus letting your symptoms call the shots.
Mm-hmm. So people see a lessening of symptoms and a return to a more normal life where they're more
Yes.
aware of their physiology. And what I love about biofeedback is with that awareness, you can learn to control your physiology.
Absolutely, because things like breathing and muscle tension are both voluntary and involuntary. When you have that fight or flight response, you're involuntarily holding your breath and tightening your muscles, but you can catch that and you can undo it voluntarily. And how it's helped people in the past is you might have someone who was in an 8 out of 10 pain every single day, and now able to bring it down to maybe a 4 out of 10. A 4 out of 10 is still, it still hurts, but you can still do your day, versus an 8 out of 10, nothing, the day's over. You're not going to do anything more when you're already at an 8 out of 10.
And what's a typical course of treatment, and does staying in treatment longer make a difference?
Yes. So some people, I would say an average is 12 visits over 2 to 3 months. Some people, depending on the severity and how long they've been dealing with it, if they've been dealing with chronic pain for 20 years and they're on a lot of pain meds or anti-anxiety meds, it's going to take longer. It might take 4 or 5 months and up to like 16, 17, 18 sessions. But then you're going to get people who, I had a person with insomnia coming that in 6 sessions, we had him back to his normal sleeping schedule. And I mean, he had started at not having like 3 hours at most, or nights of no sleep whatsoever. And that had been a reaction to another medical problem he had that summer. And his entire sleep process had gotten so interrupted. And we were able to get him back on track in 6 sessions in less than 2 months, where he was, back to sleeping completely normal without any kind of medication at all.
That's great. So where is your practice located?
In Beaver Dam, Wisconsin.
Oh, okay.
We're in the deep freeze right now.
Yeah. Well, we don't know when people will be watching this. It might be hot
True.
summer by then. So is there anything else you'd like to tell people about your practice?
I just find that when people come to these sessions, I tell them I want them to really look forward to them when they wake up that day and go, oh, yay, it's biofeedback day, because it's a whole hour a week that it's just all about you. because usually at this point, by the time you're sitting in my office, you have been taking care of everybody else for a very long time and neglecting your own needs. And now your body is telling you, don't neglect me anymore. We can't take this. And so it's your turn to focus on yourself and for us to just take care of you and focus on your health. So it's a very enjoyable, relaxing therapy. And again, you're filling your toolbox full of tricks of things that you can use to help yourself for the rest of your years.
And, I think another thing about this type of approach is that any side effects are positive.
Right.
Unlike with medication where you get side effects that, are unpleasant, with biofeedback, the side effects are you feel happier, you feel more relaxed, you feel more connected, you sleep better. There's all these positive side effects. The conditions you didn't come in for to treat that you forgot to mention tend to get better, because when you calm the body down, which is what a lot of these techniques, especially the biofeedback, is about, you get system-wide results that are very positive. And I can attest to that because 43 years ago, I was dealing with disabling chronic back pain, and none of the medications helped me. And I went for biofeedback, and it turned it around almost immediately. And it's this many years later, and I still use those techniques and they still help me.
I love it. I've always been so fascinated by the brain-body connection. And that gets me so excited to hear your story, because I've been doing this for over 30 years and I've heard so many stories like that. And it's just, I love it so much. And I think everyone should come, because you can learn these skills that you will use in different situations on and off for the rest of your life.
Yeah, I often call biofeedback the best kept secret in medicine, because it's been around since the 60s or so, 1960s, and still so
the best kept secret that we don't want it to be a secret.
Right. Yeah. So I hope that if people who are listening to this are in your area, I know they can contact you. How can they get in touch with you?
So the website is mindbodyotwi.com. My email is sbaumann, that's my name, SBAUMANN at mindbodyotwi.com. And the phone number, you can call and leave me a voicemail or text me, leave a text message, 920-382-6900.
Great. And of course, you can find Susan on the Alternative Pain Treatment Directory. And if she doesn't happen to be in your area, you can search for providers on our directory who are in your area, including ones who offer similar services. So thank you all for listening. Have a great day. And thank you, Susan, for joining me on this.
Thank you, Cindy.